Well, hello. We're talking about constipation. Can we talk about constipation in a classy way? I'm gonna try. Okay, hi, welcome. Welcome to my special edition about constipation. First off, I get a lot of questions. Why would we be talking about constipation after a facelift or after plastic surgery? Few things can cause you to get constipated. I'm going to tell you why you can become constipated, who cares, why it even matters, how you can avoid it, and what to do with it when you find yourself constipated. As always, please subscribe and share this with your friends, especially your fun girlfriends. I would love that. Anyone that's interested in plastic surgery. Okay, so jumping in. We have a tendency to get constipated after any surgery for a few different reasons. A lot of times if you have a long surgery, you're under anesthesia for a while, and then you get home and you're really not moving as much as you normally would. That in itself, everything's slowing down, that can cause constipation. Then if you have any sort of narcotics, that definitely causes constipation. And personal story, as a nurse, we always tell people this, but then when I had surgery myself, I kind of thought I was like above it all. No. It's amazing, those narcotics, how they can constipate, and it can sneak up on you like that. But we'll get back to that. So first off, why does it even matter? Why does it matter that you're constipated? No one likes to be constipated in the first place, but here's why it's really important that you're not constipated after surgery, especially cosmetic surgery, especially a facelift. In order to avoid certain problems, in order for you to get the best result possible, which is why you're doing this, right? In the first place, you want a great result. You want to keep the pressure in your head low, okay? And so that's one of the reasons that a lot of times, not every surgeon's different, but a lot of times the surgeon will have you sleeping elevated. And that's the reason that every surgeon wants you to not bend over and things like that. If you ever have to get down and get something, they want you to squat, right? Because they don't want you raising the pressure in your head, because that's going to mean you're bleeding more. And then we want you to avoid things like bleeding or hematoma, which is a little collection of blood under the skin. Mainly because those are problems we want you to avoid, and we want you to have a great result, and those things will prohibit that from happening. So how does constipation play into that? Well, think about it. When you're on the toilet, and I'm going to try to say this in a classy way, and you're kind of bearing down, think about it when you even just now, if you were to hold your breath, the pressure in your head is going to elevate, and that's what we don't want. So first off, of course, my little caveat, you're always going to follow your surgeon's orders. But one thing I always have my patients do is anytime they start taking narcotics, they also take either an over-the-counter stool softener or some other kind of natural ways to try to prevent constipation. And I'm going to go over some of those now with you. So one of my favorite things is I love prunes. And first off, usually you know if you like prunes or not, but they even have these fancy new ones. But there are a ton of different types of prunes. I would have my patients start taking one of these if they're a prune person, if they're okay eating them. I have them start taking them, if they take a narcotic, they take a prune. You just kind of want to avoid the whole constipation situation altogether. Apple juice is also something that's really good. And then also, I even make my patients homemade applesauce. You don't have to make it homemade, but I like to keep it a little fancy. So I make homemade organic applesauce. And but you can even get those little applesauces, which actually are really handy, because sometimes that is all you really need, and then when you're done, you just chuck it. But you can keep those on your nightstand, and in the middle of the night, if it's not time to get up, even though walking's good, we know that, if it's not time to get up, but it's time to take a pain pill, and you just need a little something on your stomach, it's good you can keep those right on your nightstand, and you can just take some applesauce. So the applesauce is high fiber, which is going to help your bowels moving. Walking is also helpful to keep your bowels moving. And of course, after surgery, we want you to walk a little bit, but you also want to find that balance of resting and walking. When I was in the hospital and I was a post-op nurse, if you had your gallbladder out, if you had, there are any different of the major surgeries, we would have you walking right away, breathing deep, walking. But with plastic surgery, they really want you to find that really good balance of, they don't want you getting in bed and staying in bed. You don't want to do that. But you want to just take little trips to the toilet. And even when you're doing that, you're still going to be walking, of course, less than you normally would. That leads to constipation. So some other things that are gonna help with constipation, of course, water, water, water. And if you don't like water, you can get like those electrolyte drinks or the little tablets that you can put in your water to just kind of make it a little tastier and add some electrolytes. And then there are a lot of things like magnesium. I even think somebody, when I posted on one of my other social media sites, said something about prunella, like there's a pill. So if you don't like prunes, it's like called prunella or something like that. It's kind of a prune form, all the benefits of prunes in a pill form. So then there's also milk and magnesia. There's a lot of different things that you can take that are more medicines. One of the things I really love, and this is organic and organic smooth move tea, and a lot of different companies make their own version of this. I'm not affiliated with any products, but this one is by Traditional Medicinals. I just love this stuff. It tastes so good. It's surprising how good. This is something I would save for, okay, I'm definitely constipated and we need an intervention. So, and this is best, I usually take it at night. I should probably read the directions, but that's just what I do. I take it at night, and then usually in the morning it will kind of help you have a bowel movement. Okay, another thing I want to share with you, and this is fascinating. So if you've ever heard of Lamaze, or maybe you did Lamaze class when you were pregnant, or you know someone that's done it, you know, there is a direct correlation between this area here and our pelvis. So our jaw and our pelvis, or you know, between your legs. And what's fascinating is when you relax one, the other one relaxes. So sometimes when we're on the toilet and you're straining, you're really like kind of holding tension here. So when you are on the toilet, getting ready to have that first bowel movement after surgery, you definitely want to keep this area loose. In Lamaze, they actually have you make certain like blowing and make certain sounds. I never did Lamaze, but you know what I'm talking about. You do certain, you know, humming or things to gently keep this area loose. And the reason you do it is because it keeps things loose down there. So this is for men and women. If you, anytime in your life when you're constipated, you can really focus on loosening your tongue, kind of moving your tongue around, keeping your jaw loose, and down there will also kind of loosen up, which is super helpful. So I hope these tips helped you. So just remember, it's normal to get constipated after surgery. You want to kind of try to start early on with just trying to prevent it if you can. Don't feel like you failed if you do get constipated. It is really, really normal. And then you just want to take the appropriate actions. There's a lot of over-the-counter things you can take, but you just definitely want to do yourself a favor. Drink a lot of fluids and just be prepared, kind of have some things in your little kind of toolbox in case you do get constipated, so you don't have to run out to the store, and you can just stay at home and just kind of, okay, it's time for the big guns. We're gonna have some smooth move tea, or we're gonna, you know, take it up a notch, and the doctor is recommending milk and magnesia, or all these things can be bought in your local grocery store. So I hope you'd think I did a good job keeping it a little bit classy. And I'm a nurse, you know, we love to talk about this stuff, but I just really wanted to talk to you about this because it's something that comes up with every one of my patients, and it's something that you really should kind of plan on and have some actionable steps you can take to combat it and then to treat it. Happy healing. Thank you for watching.